All right, if you're sitting at a desk right now, you really need to listen to this one. I'm your resident physical therapist, and today we're diving into an explainer that's going to totally reframe something that might seem, well, kind of bizarre. We're talking about just lying on the hard floor. We're going to turn this simple habit into a scientifically backed daily clinical intervention for your spine. We're unpacking exactly how 5 minutes of absolute stillness can literally counteract the profound musculoskeletal damage of modern life.
So 1400. What's the deal with this massive number? Well, it actually represents the newtons of compressive force crushing your lower back at this exact moment if you're sitting in a chair. From the second you sat down today, your pelvis tilted backward, that natural curve in your lumbar spine completely flattened out, and the load on your discs just absolutely skyrocketed. A lot of people don't realize this, but sitting actually compresses the spine way more than standing does.
Okay, really quickly, here is our clinical treatment plan for today. We're going to hit the sitting diagnosis, floor versus mattress mechanics, mechanical release, the systemic shift, the aging spine, and finally, your daily prescription.
Starting off with Section 1, the sitting diagnosis. We're looking at exactly how the modern chair acts as a silent mechanism of injury. Back in 1964, a researcher named Alf Nachemson did something wild. He literally inserted pressure transducers into living spinal discs to gather foundational spinal loading data. He found that sitting spikes your spinal load up to a whopping 1,400 newtons. But here's the crazy part. Transitioning from that desk chair to lying flat on your back on a hard floor drops that force down to just 250 newtons. It's literally the single largest compression reduction you can possibly get without leaving Earth's gravity. Moving on to Section 2, floor versus mattress mechanics. Let's talk about information versus comfort. So here's the crucial point. A mattress is designed to deform around your body. It creates this cozy little mold that completely hides and accommodates your postural asymmetries. It's built for comfort, right? But a hard floor? It provides uniform proprioceptive information. It tells your brain exactly where your body is in space. Your brain's sensory center gets this total body map, which basically forces your alignment to recalibrate against a completely flat, unyielding surface. Section 3, mechanical release. This is a true head-to-pelvis treatment. Let's start right at the base of your skull. You have these 4 deeply proprioceptive muscles called the suboccipital muscles. When you're staring at a screen all day, these guys are continuously firing to stabilize your forward head posture. By resting the back of your head directly on a hard floor, no pillow, just the floor, you're applying rigid, direct pressure right to those specific muscle attachments. This sustained pressure acts as a powerful mechanical release, and it often immediately resolves neck tension and those nasty cervicogenic headaches. A soft pillow just caves in, but the floor? The floor actually does the work. Moving down your back, let's talk about your shoulder blades. If you lie down flat and you can feel a gap between your shoulder blades and the floor, you are literally palpating the exact millimeters of muscle shortening caused by years of typing. Your chest muscles have pulled forward and shortened. But as you just lie there, the rigid floor acts as a diagnostic tool. Gradually, gravity takes over and forces those scapula to settle back down into a neutral, healthy alignment. Now this is an absolutely massive one for lower back pain, the POS major. When you're stuck in a chair at a 90-degree angle for 8 hours, this deep hip flexor drastically shortens. And because it attaches directly to your lumbar vertebrae, when you go to stand up with a shortened PSOS, it violently pulls your lower back into this painful arch. But when you lie perfectly flat on the floor, your hips are placed at 0 degrees of flexion. You're finally giving this deep muscle a sustained, passive stretch. It's super fascinating to watch this physiological timeline build minute by minute. In minute 1, your body actually kind of fights it. Your fascial layers resist the floor. But stick with it, because by minute 2, those suboccipital neck muscles we talked about start to release. Minute 3, your brain's proprioceptive map stabilizes. By minute 4, that stubborn psoas muscle finally yields, letting your lower back settle closer to the ground. And by minute 5, with all that compression removed, your lumbar discs actually begin to rehydrate. All right, Section 4, the systemic shift. We're rewiring your nerves here. Lying horizontal on a totally stable, rigid surface triggers an instant parasympathetic shift in your nervous system. Your blood volume shifts centrally, which triggers vagal pathways that actively lower your heart rate and your systemic stress. And because the floor is completely stable, your anti-gravity postural muscles deactivate entirely. Your metabolic postural cost basically drops to 0. Plus, the floor is usually about 15 to 20 degrees cooler than your body, acting as a mild thermal stimulus that pushes you even deeper into a resting state. It really is a total autonomic reset. Section 5, the aging spine. Why this becomes absolutely critical for our health over time. As we get older,
Our spinal discs lose proteoglycans. Those are the molecules responsible for pulling water back into the disc. So by the time you hit age 55, a standard 8 hours of sleep just isn't enough to fully rehydrate your spine anymore. You literally wake up shorter than you used to be. That is exactly why a 5-minute, midday floor decompression window becomes an essential physical therapy intervention. You absolutely have to give those squeezed discs a chance to breathe and rehydrate before the day is over.
Which brings us to a really powerful study from the European Journal of Preventive Cardiology. It turns out this simple act of transitioning to and from the floor is a super reliable diagnostic test for your musculoskeletal fitness and overall longevity. The test is simple. Try lowering yourself into a seated, cross-legged position on the floor, and then getting back up, using as little support from your hands or knees as possible. If you avoid the floor simply because it's uncomfortable, you're inadvertently accelerating your own physical decline. Making floor time a daily habit maintains your hip mobility, your quad strength, and the essential motor coordination you need to stay independent as you age.
Finally, Section 6, your daily prescription. Let's get into a highly practical home program.
First things first, you've got to choose your surface carefully. Hardwood, tile, concrete, or a very, very thin yoga mat are absolutely perfect. Do not use a thick rug, and definitely don't use your bed. You have to prioritize information over comfort here. Remember, you need that rigid, unyielding surface to give your brain the proper proprioceptive feedback and actually force your muscles to adapt to a true neutral alignment.
So here is your step-by-step daily protocol. Step 1, schedule it. Around 3 p.m. is ideal, or immediately after a workout when your nervous system is really craving that parasympathetic transition. Step 2, lie strictly flat on your back on the floor. Step 3, extend your legs fully to stretch out that psoas muscle. Now, a quick clinical caveat here. If you have sharp lower back pain, keep your knees bent with your feet flat on the floor to start, just to let the lumbar spine settle. And step 4, do absolutely nothing. Don't stretch, don't fidget, just let gravity and the rigid surface do all the work.
I'm going to leave you with this final, somewhat provocative thought. We spend millions of dollars on ergonomic desk chairs, standing desks, and specialized back treatments. And yet, the absolute most profound medical intervention for your spine requires zero equipment, zero movement, and absolutely no effort. It just requires 5 minutes of stillness on the floor beneath your feet. So, will you make the trade? Try it out today and just see how your body responds.